And I'm going to call this meeting to order. We'd start out with the introductions. Gary?
Gary Rosen, member of the Board of Health.
Leo?
Leo Negron Cruz, member of the Board of Health.
And I'm Frances Anthes. I'm the current chair of the Board of Health. I'd ask staff to also introduce themselves.
Michael Hirsch, Medical Director for the Division of Public Health.
Tamara Lundy, the Director of Division of Public Health.
Nikki Nixon, Deputy Director, Division of Public Health.
Kyle O'Connor, Tobacco Prevention Specialist, City of Worcester Department of Public Health.
Devon Thornton, Environmental Health Coordinator, Department of Public Health.
Emma Stefanski, Environmental Health Coordinator with the Division of Public Health.
And our guests.
Henry Schwan, reporter, Worcester Telegram and Gazette.
Alexandra Kalkunis, Law Department, City Solicitor.
Mohammed Al Omari, I'm the business owner of Fire and Ice Smoke Shop.
Thank you very much. And folks on the virtual meeting.
Hi, Amelia Houghton, Chief Public Health Nurse for the Division of Public Health.
Thank you, Amelia.
Desiree Sutton, Business Manager for the Division of Public Health.
Thanks, Desiree.
Brenda Wright, Principal Clerk, Division of Public Health.
Thank you, Brenda. Anyone else willing to identify themselves? Okay. I do expect, as people who were tuned in last time know, one of our members is doing some traveling for business. Last time there was a time difference and we were off, so we did not have the quorum because he called in a little bit later. But I do expect that we will probably have Michael Parado joining us. However, we have a quorum, and so we are ready to move forward. I'm looking for approval of the minutes of the last meeting.
I move to approve the minutes.
Thank you, Leo.
Gary Rosen, second that.
Thank you, Gary. I'll take the vote on that now. Gary?
Gary Rosen, yes.
Leo?
Leo Negron Cruz, yes.
And Frances Anthes, yes. So the minutes as written are approved. Amelia, I think you're next listed on the agenda for the communicable diseases update.
Amelia,
I think you're muted. Good, I was talking to myself, I was practicing.
Okay.
To the chair, to the board, this is the communicable disease update. This is for the month of September, okay? So if you have the report in front of you, you will see that there are no significant changes in disease prevalence compared to the previous month of August. COVID-19 remains the most prevalent condition. In September, there were 187 new confirmed cases. In August, there were about 193. Influenza activity was pretty low. There were no measles or malaria cases in September. And there was a little bit of salmonellosis. Every month we get a couple of cases. There were a couple in August and one in September. And those were the ones that were most notable during that time. Also, what was going on was weekly arbovirus updates. So as of 10/14, we no longer have an arbovirus update for the year. The one I sent out last Monday did here. So I've updated this report to include those numbers. So what we had was in Central Mass / Worcester County, 8,788 specimens were tested between June 15 and October 10. That was the last day of testing. And They've completed the aerial and ground spraying, and maps are available. I have the link there. It's the Central Mass Mosquito Control Project, and they would have the 2025 spray schedules on there if anybody's interested. So just like a little bit of a recap, 8 of the samples were positive for West Nile virus. And we always recommend personal protective measures, what you can do to prevent infection, repair window screens, wear mosquito repellent between dusk and dawn, wear long sleeves and long pants from dusk to dawn, use mosquito netting on baby carriages and playpens, protect your pets, and obviously speak to your veterinarian about mosquito repellents that are approved for use in animals, and also vaccinations against West Nile and Triple E. If an animal is suspected of having West Nile or Triple E, owners are required to report to the Department of Agricultural Resources. And there's a phone number there. And to the Department of Public Health, there's also a phone number there. And that's the State Department of Public Health. Just wanted to highlight something. The travel acquired cases, there's 2 diseases that are usually prevalent in that category every year. Dengue fever, which you keep hearing about, but there's one called chikungunya. And these are both travel acquired, and we report the county cases in the arborvirus reporting. So as of 10/14/25, there were a total of 4 chikungunya virus infections. 1 was found in Worcester County, 23 dengue fever infections, with 3 found in Worcester County. So chikungunya, what is it? It's a mosquito-borne viral disease, and the abbreviation for chikungunya virus is CHIKV, capital letters. It's transmitted by a mosquito. There's 2 types, actually, that can transmit it. Aedes aegypti and Aedes albopicus mosquitoes. So basically, it causes febrile illness with debilitating joint pain in some cases. And the symptoms may persist for months to years, and include fever, severe joint pain, rash, headache, fatigue, usually underdiagnosed because the symptoms do overlap with dengue. So it's self-limiting. It runs its course within 1 to 2 weeks, unless you have symptoms that proceed into the chronic phase. There's no antiviral treatment or licensed vaccine currently available as of 2024. The virus was first identified in 1952. It has since spread over 110 countries, primarily Asia, Africa, Europe, and the Americas. And because it's travel related, we are aware of it and like to take precautions. Recent outbreaks were over the past couple of years. Paraguay has seen over 100,000 cases, with increased mortality observed in older adults. South Asia and Caribbean have had a reemergence in their urban centers. Climate change and urbanization are expanding mosquito habitats, increasing the risk of transmission in temperate cities. And as of right now, there's a candidate vaccine in advanced stages of FDA approval, showing strong immune response in trials. And again, public health considerations include community engagement efforts to inform the public about mosquito abatement efforts, bite prevention strategies, travel-related risks, and all of this information is found in the weekly arborvirus reports and on mass.gov. And there are 2 references for all this information at the end of this report if you want to learn about the vaccine. So that's it for the communicable disease report.
Thank you, Amelia. So I'm assuming that we are at the stage where we're not worrying about mosquitoes here anymore, but we are in terms of people traveling. Would that be accurate?
Yes.
Okay.
In terms of people traveling, it's good to stay updated on where they're going and what's required. And the CDC Yellow Book does stay updated, even though the CDC can't at this point. Research goes into that Yellow Book. So there's still valuable information in there if you're traveling.
Okay, thank you. Dr. Hirsch.
Thank you, Madam Chairman, and thank you, Amelia. It was a great report. Few little additive tidbits for me. Our COVID numbers for the week ending in October 11th were down to 634 for the week. Previous Board of Health meeting, I reported that the number was 1,700 plus. So it seems to have peaked and gone down. We're hoping it stays down, but again, every time the cold weather or cooler weather drives us indoors, we're always a little more concerned that COVID will make a rebound.
The state numbers, the total.
Those are the
state number?
yes. In the hospitals, there is a steady stream of COVID positive patients visiting the ED, but about 60% of them do not come in complaining of COVID. They come in and incidentally are found after testing to have COVID. So this latest iteration of COVID is pretty mild. It doesn't seem to alarm people, it doesn't seem to get them sick enough to present just with whatever cold and flu symptoms they might get from it. There are some people that are getting a very severe sore throat from it. It has been called razor blade throat. Those patients do get sick. Most of the ones that are getting this razor blade throat are people that are either under-vaccinated or non-vaccinated. So the vaccine, if you've ever gotten it, seems to continue to have some protective features to not getting it again. The recommendation still is very weak from the CDC that says that people over the age of 65 should consider getting it in consultation with their primary care doctor if they have that age, diabetes, cancer, pulmonary disease, cardiac disease, obesity, or an autoimmune disease. But it's not being required. It's a discussion between your physician and yourself. It's not being recommended in patients younger than that. It's not being recommended in pregnant women. It's not being recommended in children. The vaccine advisory group at the CDC has been widely criticized by the American Academy of Pediatrics, the American Medical Association, the American College of Obstetrical Physicians, have all felt that their laxity in recommending COVID shots is going to make a lot worse of an outbreak if we have one this winter. The CDC has been in rare form over the last 2.5 weeks. You probably heard 2.5 weeks ago they fired 1,300 people in the part of the CDC that was in charge of the weekly newsletter that they put out, which was morbidity and mortality report. And those people were almost immediately rehired after they were fired because the CDC realized that they needed those people. They were the ones that were kind of keeping an eye on outbreaks. And without them, the CDC was kind of flying blind. So it's very unclear like who fired them and who rehired them, but it's kind of flown under the radar because of all the other things that have been coming out of the CDC. So you are familiar with this if you follow the news at all. There have been many strange statements about the association the CDC is trying to allege between circumcision and development of autism, about taking Tylenol during pregnancy being a risk for autism, about male fertility being 50% lower than it's ever been, about female onset of puberty being 6 years of age. None of these things have been documented or confirmed in any medical journals, and it's unclear where Commissioner Kennedy, Secretary Kennedy, has been getting this information, but it goes out there, and it just makes it a lot harder for pediatricians, obstetricians, primary care docs to make recommendations, because a lot of the patients are coming in with questions about should they get, should they take Tylenol if they have a severe headache when they're pregnant? Should they get their kids circumcised? I mean, these are all questions that, were settled law or settled medicine before, and now it's all thrown up in the air and very misleading and confusing to parents. The last thing I'll say is that I reported last time about the screw worm and the questions we were getting on our medical hotline about what is going on with the screw worm. To refresh your memory, there is a type of fly that lays its eggs in the flesh of beef cattle, preferentially, but it's also happening in deer, especially down in Florida area. And the egg forms a larva that bores its way through whatever flesh it's in. If you happen to eat a piece of undercooked meat that has one of these living larvae in it, it can bore its way right through your intestinal tract, or it can form such a reaction to its presence that you become allergic to red meat. This was a problem back in the 50s and 60s that was solved by a brilliant entomologist who also served for a while at Tufts Veterinary School. They developed a sterile fly that they could mate with the flies that lay these eggs, and the eggs would not get laid. And for years that kept this phenomenon under wraps. Mostly it was confined to the inner parts of South America. But because of a lot of problems with the cost of raising beef, a lot of the safeguards that were put into place have gone away. And I had the privilege of speaking to Professor Isabel Luge, who is an expert on this at Tufts Veterinary this past week. And she said the biggest issue is that there have been big cuts at the USDA that are making it harder for them to do the screening that they need to do for cattle, and also to prevent cattle from the affected areas from being imported into the United States. So she is worried that there's a potential for outbreaks. She doesn't think it'll be up here in Northeast. It'll start in the Southwest, and but it can be a pretty severe infection and cause of morbidity if the public really starts to eat bootleg beef, because beef is getting very expensive. Beef prices have gone up almost 60% over the last 2 years. So I don't feel too comforted by the fact that we did have good safeguards against this, but now with the USDA cuts, is that going to hold? We don't know that yet. So that's my sad report.
Thank you, Dr. Hirsch. Any questions? Gary?
No questions, Madam Chair.
Okay, I had a couple then. Dr. Hirsch, first my question is vaccine availability. My understanding is that the basic CDC recommendation at this point is talk to your doctor. So if you talk to your doctor and you want to have your children vaccinated, you are pregnant and want to get vaccinated, you're just a person who's 50 years old and wants a vaccine, is that generally available like at your local pharmacy?
Yes, our pharmacies, at least in the consortium of states that Massachusetts now has aligned with, all are carrying the COVID vaccine, and many of them are accepting, all different kinds of insurances. There are some insurances apparently in the South that have stopped reimbursing for COVID vaccination. That hasn't happened here. There are 16 states where CVS in the South are no longer offering COVID vaccine unless you have a doctor's note.
Okay, but for Massachusetts, with the work that our governor has done, I think with some other governors in the Northeast, the vaccine is available at a pharmacy, and you may get it without a doctor's note, and it will be covered by your insurance.
Yes.
So I would just say that that's kind of one of those things that in terms of educating the public, we would like people to know.
Yes.
So thank you very much on that. And then my second question is, we've talked a lot about cuts at, say, CDC and how they might impact public health, but now you're also saying cuts in the Department of Agriculture will impact public health, potentially in terms of food inspection, and particularly the meat that you were just talking about.
Yes. I don't know how many of you remember ever reading in school the Upton Sinclair book about the meat industry, but it's raising its ugly head again, and really not for any good reason. The USDA was always doing a great job, but our current health administration in Washington doesn't believe in pasteurization, doesn't believe in meat inspection, eats raw bears. What can I say?
Okay. Thank you very much. Any other questions from members here? Okay, then I think we would turn this over to you, Kyle, for the tobacco hearing with Fire and Ice Smoke Shop.
Thank you, Madam Chair. So through the chair to the board, I drafted this report to you today to discuss the third state violation, specifically a sale of a tobacco product to a minor at the business of Fire and Ice Smoke Shop at 8 Boylston Street in Worcester. So on October 3rd, the Division of Public Health conducted a youth tobacco compliance check as part of the citywide tobacco enforcement program. During this operation, I directly observed a sale of a pack of Backwoods, which are 3 sweet aromatic cigars, to a youth under the age of 21 at this location. During this transaction, the clerk asked if it was the youth's first time at the store. The clerk then asked if the youth had any identification, to which the youth responded no. The clerk then proceeded to ask how old the youth was. The youth stated that they were 17 years old. Despite this disclosure, the clerk completed the sale and provided the product to the minor. The sale constitutes a violation of Mass General Law, Chapter 270, Section 6B, which prohibits the sale of tobacco products to individuals under the age of 21. Retailers are required to verify the purchaser's age through valid government-issued ID in accordance to 105 CMR 665. The business was notified of the violation in person the following week and was issued a $5,000 citation consistent with the state penalty structure for a third violation within a 36-month period. On the next page, you'll just see a brief overview of the most recent violations from this location. The first being in January of 2024, they were selling without a permit, which then issued a $1,000 fine and mandatory education. The second most recent was in April of this year, where there was a sale of a flavored product, which resulted in a $2,000 fine, and then the board voted on a 14-day suspension for the address. And then that brings us to today, when we're discussing the violation on October 3rd, sale of product to a minor, which resulted in a $5,000 fine, and then the board is pending the suspension right now. So below that, I just have the regulation kind of laid out, which states that, a third violation within 36 months results in a fine of $5,000, and a prohibition of the sale of tobacco products may be imposed for at least 7 consecutive business days and up to 30 consecutive business days, or for a longer term enacted by the board. The retailer was notified of this violation and hearing on October 8th, and the purpose of this hearing is to allow the retailer an opportunity to be heard before the board votes on the proposed suspension. And in accordance to 105 CMR 665 and Mass General Law, Chapter 270, Section 6, DPH recommends that the Worcester Board of Health uphold the required sanction for a third violation and impose a $5,000 fine, which has already been issued, and a 30-day suspension of the tobacco permit.
So good evening. I think it's your turn now. We obviously, as a Board of Health, are pretty concerned, particularly when there's repeated violations. And that's why not only is the fine more, but also there's a recommendation to suspend the license. Do you want to address the issues with us?
Well, first of all, the ticket I paid it. I just paid the ticket on the 17th. And about the business, I wasn't in the country for 9 months. I just came like 10 days ago. I was in Jordan for 9 months. My worker knowledge, because they knew in USA, they know the law, like their knowledge about the law in the smoke shops, it's through me. I am the one who always call them and tell them not to sell underage, and always ask about the ID. Now I'm here, I'm gonna be on top of my business and on top of my worker. That's all I can say here.
Okay. Do you have questions, Leo? No. Gary?
Thank you, Madam Chair. Kyle, now, I'm just a little confused on the process of the fine, not the $5,000, but the process. So you said it was already issued, but does this board have to approve it, or is that something that's automatic and it doesn't matter what we would think or say or do? How does that work?
Correct. So the fine, it's a state violation, so the fine is preset at $5,000, but in the state law, it says, the board may suspend from a minimum of 7 days up to 30 days. So that's what we're here to decide.
Our mission tonight is just the suspension.
Correct.
Okay. And I'm going back to the violations of January 2024. Selling without a permit. You mean the whole store had no permit? I guess a tobacco permit?
Correct. So every year, every retailer has to renew their permit before the end of December. So seeing that it was January 11th, we checked in with the store. Their permit has not been renewed at that time, and they were still selling products. So then that's why they received that fine. They then renewed their permit after receiving that fine.
Is that a fairly simple process to renew that permit so they could have had it by the end of the year?
Yes, they're given 2 months' notice and 4 notifications.
Okay, and the cost of that permit?
$250 annual fee.
$250, okay. And then the sale of the flavored product, that could have been to anyone. It doesn't have to be to a minor. It has nothing to do with the age on that one.
Correct.
Okay. And now sale to a minor. I guess I'll turn to, is it Muhammad? Is that, okay. Muhammad, and are your people trained? Was this the manager of the store? If you've been gone so many months, I assume you have someone who should be responsible in charge.
My brother.
Your brother, okay. So was he the salesperson that day? Okay.
He's just the manager. He brings the products to the store and check on them.
Okay. Was the person who was working that day educated as far as the rules?
Not much, I believe. He got hired while on overseas by my brother.
Okay, he was hired by your brother, and evidently he knew enough to ask the youth his age. So he wasn't.
We always ask our worker to ask.
And why do you ask the worker? Why does the worker ask the customer his or her age? Why do you do that?
Oh, did he ask about her age?
Yeah, the customer's age. Why did your worker ask the customer his or her age?
I wasn't known.
Okay, well, evidently the reason is the law says you have to be 21. So that's why your employee was asking this person the age.
Well, the question for the customer should be, can I see your ID, not about the age.
Positively. Okay, but evidently since he didn't have an ID, or he said he didn't have an ID, then he went to his second choice, I guess, which was to ask the age, which, yeah, obviously is kind of silly if the person doesn't have an ID. So this was a package of, I don't know what this is, backwoods and sweet aromatic cigars. Is there that much profit in a box of these cigars to risk a $5,000 fine?
Well, as a smoke shop, you have to have almost everything that the smoker needs.
Yeah, that the 21-year-old needs. Yes. But you, as the owner, realize about these fines because you've already had one for $1,000, you've had one for $2,000. So you probably knew the rule. You knew the rule that if I sold to a minor just one package of backwoods and sweet aromatic cigars, I'm risking to make that $3 or whatever it is, I don't know, $5, whatever it is, I'm risking a $5,000 fine.
I wasn't know about the fine that much, but we have a lot of products that cost like $2 and I'm supposed to be sold to.
Do you understand why we have these rules? Why these rules are necessary? Right. And do you understand why this Board of Health and the Department of Public Health are very frustrated when we try to educate you about the rules and we fine you January 2024 and we fine you in April 2025, and now you come before us again with another violation, and it looks like if we don't take action tonight, you might be back in 6-8 months or next year, because it doesn't seem like what we've been doing is working. It's not solving the problem.
This is my first time here. I have no idea about
Carl, wouldn't he know about, as the owner, would he necessarily know about the first two fines?
Yes, he would know, or his manager would have to tell him.
Right. So you're not, what you're telling us is you're not really spending much time and attention on your business.
back and forth because my 1 years old son has a kidney problem, so
Okay.
I'm overseas more than in here. But now I brought them with me, so
Okay.
we're going to stay in the country.
Kyle, the second offense here was a 14-day suspension. The first offense was not a suspension.
Correct.
Okay. And your recommendation is now, is that the maximum of 30-day suspension?
In the state law, it says 7 up to 30, but then after that, it says or longer deemed by the Board of Health. So you could vote for a longer suspension.
Even
if you so
beyond
choose.
30 days?
Yes.
And you are recommending the 30 days. Why did you choose 30 days as opposed to more or less?
That's what the state law says, so I just wanted to go by the state law.
Okay. Okay. And thank you for your work on this, too. We appreciate it. It's important stuff. I mean, if it was the first offense that your business has had, I'd still be upset. But it's now the third. And my concern is if we don't take action tonight, there'll be a fourth and maybe a fifth, that it won't end. And how many licenses like this do we have out there? 200 something?
222.
222. Supposing they all do within a year and a half, they all do 3 of these. That's hundreds of violations. We can't allow that. We just can't allow that. We have a responsibility to the people in the city of Worcester, a responsibility to the youth in the city of Worcester, and the businesses also have the same responsibility. We put our faith and our trust in you, and your business has broken that. Whether you knew about these violations or not is not the question. Thank you, Madam Chair.
Okay, thank you, Gary. Michael Parado has joined us, I see. And Michael, we are in the middle of a tobacco hearing. Do you need us to recap it? I'm not sure exactly when you came in. Do you need us to recap this at all?
I would appreciate it if you could recap a little.
Kyle, I'm going to ask you to do that.
Thank you, Madam Chair.
Through the chair to the board members. So today we're here to discuss a third state violation, specifically a sale of a tobacco product to a minor. This took place on October 3rd. A minor went into the store on that day to buy a pack of Backwoods, which are 3 sweet aromatic cigars. The clerk asked if it was the youth's first time at the store. They also asked if the youth had any identification, which the youth responded no. The clerk then asked how old the youth was. The minor has to be truthful and responded that they're 17 years old. The clerk went ahead and sold the product anyway. And according to the state law, we issued a $5,000 citation, and we recommend a 30-day suspension of their tobacco permit.
Thank you for the briefing. Appreciate it.
Any questions, Mike?
No, I'm all set, Madam Chair. Thank you.
Okay. I guess I would just say one thing to you, Mohammed. I appreciate that there were extenuating family circumstances, as you've described. And I appreciate all that my colleague Gary has said to you about kind of the responsibility of the Board of Health and what we need to do in order to ensure the safety and the health of the people of the city regarding tobacco. Do you foresee a different approach going forward and how you would run things at the shop?
What is it?
Will you make any changes? What changes would you be thinking you need to make if you're getting these kinds of fines and suspensions?
I'm gonna be on top of my business. I'm gonna be the one who asking my worker to ask each one about the ID before they purchase anything.
Okay.
Yeah.
Thank you. Then I'm looking for a motion from a member of the board. You have the staff recommendations in front of you, which is the fine, which I think has already been issued, and Mohammed indicated has actually been paid already. And then the other recommendation from our staff is a 30-day suspension of the tobacco permit. Is there a motion? Anybody willing to put a motion in front of the board?
Madam Chair, I make the motion that the business license, tobacco license be suspended for 30 days. Tobacco sales permit, 30 days.
Okay, is there a second to that
I
motion?
second that.
I second.
Okay, I heard Leo first, so any discussion? Mike, any discussion?
No, I'm good. Ready to vote. Good.
Leo?
No discussion. No.
Gary?
All set, Madam Chair.
Okay, then I will call this vote. Michael?
Yes.
Leo?
Leo Negron Cruz, yes.
Gary?
Gary Rosen, yes.
And Francis Anthony's yes. So that motion carries. We would then ask Kyle and his staff to work with Mohammed on the 30-day suspension. And I really encourage you to stay on top of the business and don't come back again.
I try my best.
Thank you.
Thank you.
Okay, I hope we've done all those things exactly the way you would have liked us to do it, but I think it's now time for us to talk about how we should be doing the work that you've just seen us do.
Through the chair, so would you like to ask questions, or do you want me just to give you my understanding of, I think I'm here not really for violation permit hearing, that was great, more as how we go about changing the regulations and requests for exemptions to your current tobacco retail permit.
Right. What my understanding was, after we voted about a request for exemption, was that currently the regulations actually don't give us the permission to do any exemptions. So if you could address that issue and then talk to us about is that the way it should be, or should there be some other options?
Okay, so through the chair, that's correct. The current regulations don't allow for an exemption or a variance. So there's no process through your regulations to allow for those hearings. I would advise not to have them moving forward. And your options are you can amend your regulations to allow for a variance. Then you would have applicants come in and, file an application, you discuss, and you could grant one. I also think that you could forego that option if you just updated the retail permits a little bit. The way, from experience with liquor license that I've been assisting on 15 years, they really identify and distinguish between your on-premises and your off-premises. The way the liquor laws are written are that you have your package stores and your restaurants and bars that serve alcohol, and those are really two distinct business operations that require a different evaluation and discussion. I would suggest that you maybe pursue that avenue to have the administration come back with updated regulations where the tobacco businesses permits, they're really distinguished. There'll be one for your convenience store where you're going in to buy tobacco, and then there's an on-premises, your smoking bar, your hookah bar, so that the considerations that the board takes are different at each application, each hearing, and you might probably not even need variance that often for that because they are different businesses and should be treated differently.
Okay, so that is pretty much what we had actually, I know Kyle needed to be out of the room right now, but that is what we had asked staff to pursue because it seemed like we were looking at a little bit of apples and oranges and it didn't necessarily work. So
Right.
I
We
think
could
that
prepare that for you, like draft regulations in accordance with public health, and I could come back or you could report back on if that's comments and have a discussion on that.
That would be great. I think we had, I'm thinking that was the September meeting where that happened, but I could be wrong by a month. And that we had thought that it might take as long as 6 months because we knew that our staff would have to work with the law department.
Okay. Yeah, we could, I would say by the end of the year, hopefully, that would.
I'm sorry?
3 months maybe would be more reasonable. By the time we prepare something, bring it to you, you discuss and adopt. So maybe for, I would think no more than 3 months.
Okay. Well, thank you. We appreciate that. Any questions for the law department? Mike? Any questions?
Yes, I appreciate the fact that she's come to see us and has ideas about this regulation. If I remember correctly, Madam Chair, didn't we request something very similar from the health department, a report on how what we could do about providing a variance or different situations where it's just not, we're so stringent on that ordinance?
Yes, I think what we're actually asking is the staff to continue the work they've already started with the law department to see if there could be two different kinds of regulations depending on which kind of tobacco license it was. But I also think that we did not know that we did not have the power to make any exemptions, and that is kind of puts us all in a different position than we were in when we considered the request.
Madam Chair, didn't I also believe that they would like till February to get that report to us? Is that correct?
I think we thought that it would be in around February, yes. Which
okay. All right.
Sounds like we're still in the right framework.
All right. Thank you, Madam Chair.
Thank you, Mike. Gary, any questions?
Thank you, Madam Chair, to the city solicitor. So you started out talking about the regulations. You mean the regulations of the city or the local Department of Public Health? We're not talking state regulations here. We're talking city regulations of some sort. I wasn't quite sure which regulations you were referring to.
So through the chair, this is the Board of Health regulations on tobacco permits. It's not even the city ordinance, which
Right.
is different.
Belongs to this body.
But this is the local adoption. State regulations kind of give different options, but this is what the local Board of Health adopted.
Okay, and so if a business is turned down, which we've done a few times, they've come in front of us asking for an exemption. Now, you're basically saying we don't have the right to give an exemption.
Through the chair, you do have the right, but you just didn't establish that in your regulations. So if you wanted to establish that right, you should have, it should have been in the regulations that says the board can hereby waive or approve a variance or waive an exemption pursuant to an application and hearing. There's just no identified process or standard as the regulations
So if
currently
we
read.
put that in our regulations and we vote in the affirmative of this board, we will have the authority to grant an exemption even to the 500-foot rule?
Through the chair, you could discuss how you want it to the 500-foot rule. It could be business to business. It could be you are the ones that to come up with that standard.
So if we go back even a few years where I've been on this board 4 years, I guess I can remember maybe 2, 3, 4 exemption hearings, and there might have been others before I was on here.
I think we've had 16, am I right about that?
16 on this, with this group, with the time I've been here?
That may be accurate. I've only been present for about 3 or 4, I believe.
Okay, I
16
think
of them?
since the time we've had the regulations, I think there've been about 16 requests.
Okay, since the time. So how long have we had the regulations?
Just a correction, yes, there have been at least 16 requests and denials of permits. Misunderstood. Gary, what was your question?
When did we establish these
The
regulations?
regulation was put in place in October of 2023.
About
October of 2023.
Okay, so I was here, all right, so I should know that certainly. So there is an appeal process. There will be, once we clean up our regulations, there still will be an appeal process for these businesses. These 16 businesses, all of whom were denied an exemption, am I correct?
Yeah, so I think we mentioned it a few meetings ago that we have an intern on that's currently drafting some policy updates
Okay.
for your regulations.
And you'll be working with the law department too, they're
Yes,
getting their.
and that would be an option that we would bring forth
Right.
to you folks to
Right,
vote
but
on.
to clarify, we may or may not make those exceptions. In other words, it's still in front of us.
Well, we don't
what
have
decide to do.
I think the
Right.
city solicitor is saying right now, we don't have the authority, but cleaning up our regulations, we will have the authority. Am I correct on that?
Well, we could give ourselves the authority, or we could say, no, the regs are the regs, then there's
Okay,
no
right, if we-
exceptions. Yeah.
Okay.
Correct.
Okay, so we have that choice, obviously. Okay, now, so if we look at these 16 hearings that we had, where it sounds like we've denied each one, which is fine, I'm not knocking that. I'm just saying that, does that mean that those hearings basically didn't really exist because we didn't have that in our rules, and all 16 could say eventually, if we decide to come up with new regulations where we do have the authority to grant an exemption, can they all come back and say, well, that didn't count?
Through the chair, so usually regulations are not retroactive, but where you've, discussed the fact that you weren't really aware that you did not have the right, you could either grandfather them and allow them to all reapply. You could say, no, we voted no on everyone, and that would stand even if we did have the authority. So the regulation is effective as of so-and-so date. It really depends on
But
what
we
the
have
board
some
wants.
options, it sounds like.
Absolutely, yep.
Am I right, Madam Chair, that this board, even before any of us were on it, never had the authority to do this?
Through the chair, I'm not aware of regulation that would provide this.
Kyle, any idea about that? All boards, previous boards, I assume we go back decades with the Board of Health in Worcester.
The way that the regulations are written and the regulations that are standing, there's not a path of appeal process. So
With the present regulations, nice.
Correct. So
I'm
if
just asking, has it always been that way, even though we didn't know it?
I do not know.
So through the chair, the role of the Board of Health for Worcester changed and with the special legislation 2014, 15, somewhere around there, maybe, where it really gave the board, it's a strong Board of Health, and it gave the Board of Health the ability to do something like that, where prior to special legislation, the Board of Health was really just an arm of public health and probably didn't even have that authority at that point.
Okay. And so you're suggesting that before this board does anything with possibilities of granting exemptions, we come up with new regulations first and discuss those and eventually pass. Well, I guess we wouldn't have to make changes in our regulations. We just wouldn't have the authority to, if we made no changes, we just would no longer have, we wouldn't have the authority to make exemptions. Okay. So I'm looking forward to that. I guess it's going to be by the end of this year. Doesn't seem like
We can
it's
present a report to you, by the end of the year. That would kind of give you a couple options of updated regulations, exemption, variance forms, and, processes. And then you can discuss, take the vote, or if it takes longer than that, a couple of meetings, you can do that. But we can have the report to you by the end of the year.
As our city solicitor, do you personally have any opinions about this board granting such exemptions?
My recommendation is that the board has the authority to to vote either way. So whatever the board comes up with a discussion, they should do. I have seen how it works though with License Commission, that how the two businesses really are different. So I do think it's worth looking into that and discussing, what factors you would consider when you have a convenience store versus, smoking lounge. Just because you might have a different set of factors for each one that.
Because our present rules say that if you want to open a smoking lounge and you're next to a convenience store that sells tobacco, you can't do it.
Correct.
Even though they're two very different things.
Yes. You can't go into the convenience store, buy tobacco, and go smoke it at the lounge, right? You got to buy it on the lounge on premises.
Right.
So it is a little bit of a different situation that probably doesn't apply to other permits.
And I think that one of the things we found in the last couple of months was that because they were all lumped together, the 500 feet part also becomes a problem, because if you're trying to do retail and you're next door to a smoking lounge, et cetera, or vice versa. Yeah. So I think we will have to look at both those pieces.
Okay.
Because they tie together.
Do you happen to know, Madam Solicitor, if other cities have an exemption rule where their boards of health can grant exemptions because they have the proper regulations?
I would defer to DPH on that, but there are multiple different versions of these regulations. A lot are very narrowly interpreted. There's a lot of it's usually more narrow, I would say, than a broad interpretation. So
I don't know if Kyle has any opinion or knowledge on that, what other cities do.
I have my intern who's looking into those regulations, trying to find different policy options, and we do have those options getting ready for you guys.
Not that they're any wiser than our DPH or our Board of Health. They're probably not, but it'd be interesting to see what others do. Okay. Thank you, Madam Solicitor, and thank you, Madam Chair.
Okay, thank you, Gary. Leah, any questions?
No questions.
Okay, thank you very much for coming. It's helpful to have you here explaining it, and it will be helpful to have you working with Kyle and the staff as we try and make this work better. Thanks, Alexandra. Okay, I think now we're going to turn it over to Emma and Devin to talk to us about the Inspectional Services Department, just letting people know that this is the work we have in front of us.
Good evening, Madam Chair, members of the board. I'll just ask if Desiree could pull up the presentation. All right. There we go. Okay. So the purpose of this presentation is really just to provide a brief overview of the new collaboration between Inspectional Services and the Division of Public Health. And again, my name is Emma Stefanski, and this is my coworker, Devon Thornton. We're the environmental health coordinators through the division. So although the Division of Public Health and the Inspectional Services Department are under two different departments, we want to focus really on the Division of Health and Housing Inspections. They're most relevant in this case, and what we'll be talking about during this presentation. But both divisions really aim to enhance and provide public health services to the city of Worcester, just in different aspects. Next slide. So the board was previously briefed on SAFE 2.0, which is a new law that was signed into effect in November of 2024. I won't go too much into it to avoid being redundant, but there is a requirement to meet performance standards that are set by the state. So under that section, it will go into inspections and local permitting. The goal really is that if we can improve the reporting at the local level, we'll be able to allow for some consistency and support from the state level surrounding our inspectional needs and our permitting needs. So this is a very long list of all of the new codes and regulations that come with SAFE 2.0. Our Inspectional Services Department is our authorized health agent, and they are allowed to conduct these inspections on behalf of the board. and they have been for quite some time. So they are, as I said, the Health and Housing Inspections Division under Inspectional Services is the primary division we'll be focusing on, most relevant to Safe Point 2.0. And they're divided into 4 units, but we want to focus on the 3. So our housing unit does just that. They enforce the state sanitary code. For housing inspections, they investigate lead paint complaints and lead poisoned children, and they also do some of our city nuisance ordinances as well. We have our food protection unit that does just that. They do all of our food establishments in the city, from grocery stores to restaurants, also churches and schools as well. They do any temporary events that happen in the city that there's food served to the public, and mobile vendors as well that all require inspections and permits. And then we have our air, water, and hazardous materials unit that focus on some of our more seasonal inspections, like bathing beaches and summer camps for children, but then they do also some of our yearly inspections like tanning salons and all of our septic and Title V work that goes on throughout the city as well. So with this new law comes a new awareness of responsibilities for the board. The board has the ability to approve and deny variance requests for some of these new codes and these new regulations. They can adopt or amend health regulations and resolve disputes. The way that it is currently set up is Inspectional Services, as our authorized health agent, handles a lot of these in-house. So we're working with them to iron out what should be coming in front of the board. As I demonstrated, there are a lot of new codes and regulations. So without inundating the board, what is most prevalent in this case? We're also looking to really enhance our reporting to the board. So we want to start out by offering quarterly reports of our inspectional data to the board. This will help identify the volume of inspections per category, as well as the number of permits issued. Based on this information, the Division of Public Health will better be able to map city trends to tailor our education to the public and any program interventions. And then as a part of SAFE 2.0, there is an annual report that the board will be responsible to provide to Mass Department of Public Health. So this will all just kind of be setting the board up for success for that annual report. And thank you very much, and I'll open it up if there's any questions.
Okay, Gary, any questions?
I do not. Interesting that we're going to have this relationship. And I'm looking forward to working with the Inspectional Services in the future.
Thank you, Gary. Mike? Michael, can you hear
All
us?
set, Madam Chair.
Okay.
Yeah, all set, Madam Chair. Thank you.
Okay, and Leo? So my only question is exceptions. So we just went through a bit with the law department in terms of exceptions to the tobacco regulations. And I see that the Board of Health is going to have different kinds of responsibilities in terms of approving and denying variance requests, which immediately brought me to, and what about the exceptions? So I just think that with this additional responsibility, and I appreciate that it's really good to tie things together in terms of the Board of Health, we probably need to pay attention to if there is any process for exceptions, if there should be any process for exceptions, if we want no process for exceptions, but that probably is one of those things that we should pay attention to.
Yeah, so if I may, a lot of the codes that our inspectional services team enforces are state codes. So the state does have a section in most of them that talk about the variance process, where we run into yes or no if we want to allow variances as at the local level and any regulation that the board may pass. So like tobacco, for example, but in the food code, there is a process that talks about variances, and there is some processes that establishments may take that require a variance from the board.
So we will need a lot of education on that. Thank you.
Madam Chair, one question for you.
Yes. Gary.
So, Emma, this report was made for the Board of Health, correct?
Correct.
That's why it was supposed. So, I'm going to ask the city solicitor. I know this isn't the city council, but we have a report here that we can read, study, use in the future, question tonight, and so on. But we never do anything with it as far as file it, refer it to a committee. We don't do anything with it. Are we wrong to take reports like this, which we often do, probably every meeting, and not make some decision on where they go or what we do with them? Just say, okay, we've asked our questions and those are in this pile. So I don't know. I'm thinking of how the council would do it, but maybe this is so different.
Yeah, so boards and commissions are, I will just say the council does its own thing. They have their own rules, but this would just be an informational transmittal. You don't have to take a vote on it. It's just for your information, and then, you know, regulations will come before you to adopt. But this is common practice for boards and commissions to receive such reports and not take a vote on it or not act on it.
Okay, so put one on the plus side for the Board of Health doing this one right.
Okay.
Thank you.
Thank you, Gary. Okay, the next thing on our agenda is the body arts regulation, which, as you know from looking at the previous PowerPoint, is part of the Food Protection Unit of Inspectional Services. We actually adopted a new piece of the regulation over a year ago, back in June 2024. Gary will probably remember. Yep. They came to us, and Devin can help us explain this, but they came to us to ask if there could be an addition to the regulations that were already in place in terms of apprenticeship programs. Do you remember that conversation? And so we did adopt that. And Devin, maybe you can just remind us how that went.
Madam Chair and the board, I know how that went from the meeting. I watched the meeting. And I think Mark Abraham from the food division, he explained what the the requirements were going to be for an apprentice for body art were going to be. I think after going through the process, it was presented to the board and it was approved. But on June 3rd, 2024, it was just never signed. It was brought to our attention by ISD that it was never published with the city clerk's office because it wasn't online. I asked Mark questions about the regulation, and he explained to me that it was never signed the day of approval. So therefore, in order for the amended regulation to be effective, it needs to be signed by the board. We need to have a true and attested copy sent to the EP. No, I apologize. It first needs to be presented to the public. So it needs to have a public notice. And after that, we need to have a true and attested copy sent to the EP and the city clerk's office. And 5 days after, it would go into effect.
Okay.
So right now, we're just at the signing process.
Right. So I would just refer committee members to the practitioner training and experience and practitioner apprenticeship requirements, part of this, which we have already approved.
Yes.
And we just need to sign it. But we're going to sign one copy. And Michael, we're going to ask you to sign it at your leisure if you're comfortable with that. But several of us in the room can sign it right now. Is there any question?
That's fine, Madam Chair. I look forward to signing it.
Okay. Is there any question about this? It was a while ago, so I'm wanting to make sure people are clear on what we're doing. And does this require any further discussion?
Madam Chair, maybe city solicitor, is it okay to have members sign this who weren't on the committee, the Board of Health, at the time we kind of amended these regulations?
Through the chair, I would only have the members that voted on the regulations.
Okay.
Sign it.
What, 2 of us?
3 of us.
If you had a quorum.
Leo was here. We did take off the person who has since left the board. Okay. So Michael, maybe we don't need your signature because I don't think you were here in June of 2024.
One question.
No,
Do you
no worries, Madam Chair.
I don't remember
That's fine.
when you joined the board. Do you?
I believe it was after that.
Okay. It was an exciting meeting. You probably would have remembered it.
Got tattoos that week.
Thank you, Madam Chair.
I love Worcester, right. Okay,
I have one quick question.
yes.
Why is what do we call this, the body art regulation or division, why is that associated with, did you say food inspection? I don't see the connection there.
At the time, they were trying to separate duties amongst, my apologies, amongst the departments, and the food division just ended up doing the body art, and air and water, the air and water division ended up doing tanning facilities.
Because we didn't have the right group to deal with those areas? I mean, still, why didn't you put that who's over in tobacco?
Because tobacco was under DPH, Department of yeah.
I guess it makes sense. Good work. Thank you. Thank you, Madam Chair.
Okay, thank you, Gary. Okay, I'm going to turn to Tamara next for her report. I would just, before she even gets started, we asked Tamara to specifically look at the local policy guide outlines from the group that we were referred to in San Francisco, which she has done, and that's part of your report. I just have one question on this, and it seems to me that items for consideration, which are ones that would take lengthy board discussion and understanding, that some of those may already exist, but not necessarily in exactly the structure that I see here. For instance, I'm thinking that the Office for New Americans, which is at a Friendly House, and RISE does some of the things that are listed here. So maybe after you give us your report, and I know that this won't be the only thing, you could give us a sense about whether we should be doing some more homework on the considerations, or whether we should talk about it tonight.
Thank you, Madam Chair. That actually what's going to be the full report. I was going to focus on those on the summary and then the items of consideration. For the purposes of being able to have that reviewed internally a little bit more, we're going to hold on that discussion tonight and circle back to the Board of Health after we've had a chance to follow up. I know that there is also a pending item that we'll be discussing with law around the primary care for you letter that the board was interested in seeing brought before the board to consider and sign. That also is still pending, and so we'll follow up on those two items once we have more information internally. Thank you.
So I would encourage my colleagues to get a chance to look at this Immigrant Legal Resources Center Guide summary. There's some very interesting things here, which I think after some internal review, we'll find that some of these are actually happening, not necessarily all of them at City Hall, but within the broader city response to immigration issues. Okay, is there anything else we should be talking about tonight? How about the accreditation site visit that's coming up?
Yes, that is this week. So the Division of Public Health, we're gearing up for our reaccreditation for FAB. That is on Wednesday and Thursday of this week. Those will be full days for the team with our site reviewers. We also have two of our board members who will be also joining us on the second day. So thank you in advance for your participation in that. The team has worked extremely hard for many months now preparing for these 2 days. And so I'm incredibly proud of our team, and I want to say that publicly and thank them for all of the work that they have done to help prepare us to get to this point. I'm confident that we will do really well during this site visit. We will have 48 hours, business hours, to reply or respond to anything that the site reviewers bring up during their site visit. And so we will be busy up until Monday of next week. Hopefully not too busy, because that will be a sign that it went really well. But excited to reach that milestone, and I want to again thank all of the DPH team for all of your work to get us to this point. Thank you.
That's an incredibly short turnaround time. So I hope you're all getting some sleep. I hope we'll make this meeting end kind of quickly because that's a lot of responsibility for you this week. And I'm really surprised at how quickly you have to turn around the responses. So good luck. We're with you, and we hope it all goes well. So I would, I think, be moving us towards a next meeting date and topics. One of the things that I noticed come out today was the city manager has apparently announced that the emergency winter shelter that we've seen in the old Department of Motor Vehicles building will not be happening downtown this year. I just read it. So I would like to put that on the agenda. What is the plan for emergency winter shelter? I would like to put that on the agenda. As Tamara mentioned already, the primary care for you issue is still in front of us. And then this Immigrant Legal Resource Center guide and recommendations, I think, would also be something that we are looking for on the next agenda. Are there other items that we need on the agenda?
So the old registry former shelter won't be used by us, the city, this year.
That's what I read coming across quickly on
So it's going to just
email.
remain.
So I don't know
It's
what
just
the
going to
plan
remain
is.
empty for the winter season.
I don't know the plan at all. That's why I would say, let's ask staff to find that out for us
Okay.
and put it on the agenda.
Madam Chair, the city of Worcester should seize that building. I don't know if you can take that building by eminent domain, but that should belong to the city. We need it. We should be using it. We shouldn't be so timid and say, I don't know what the state has for plans for that building, but it's been empty for enough years now, and it'll probably be empty like the auditorium. When most of us are gone, it'll be empty for years again. So I think we just take the building. The state wants us to do good things for the homeless. They want that. They encourage us. Yet, they might be telling us, no, you can't use our building. To me, it's absurd.
I don't know that, I have no idea
I know.
where
I'm just
the
saying, I
decision
can't
comes
wait for
from.
this discussion.
Okay.
Thank you.
Any other agenda items that you'd like to add, Gary? I know you're ready for this one.
I got a couple, but keeping it.
Okay. Mike, are you set with this agenda, or do you have anything to add?
I think the agenda is perfect. I look forward to the discussion on the old registry building. I do agree with Mr. Rose on it shouldn't be left empty. And if we have an opportunity where we can give the homeless shelter, I think we should do the best we can to pursue that. And let's be aggressive. Thank you.
Okay.
Thank you, Madam Chair.
Thank you, Michael. Leo, any?
That's good, yeah.
Okay. Then if you'll remember, we have decided not to meet the day before Election Day, not to meet before Veterans Day. So our next meeting is November 17th.
Yeah.
And if that's okay with people, I think I would be looking for a motion to adjourn.
Motion to adjourn, Madam Chair.
Thank you, Gary.
Very quick information. And then
A second?
Leonidas, second.
Leo, thank you. I'm going to take the vote on that. Mike?
Michael Parado, yes.
Leo?
Leonidas, yes.
just have a quick question.
Gary Rosen, yes.
And Francis Anthony's yes. So the meeting is adjourned at 7:45.